So welcome to the Cancer Prevention and Wellness Lecture for August. I'm your host, Jeff Jaguar. We have a really interesting speaker and a really interesting topic for tonight. Before we get started and I introduce our speaker, just a couple of housekeeping items. You will be muted while we're going through the session and the speaker is speaking. We do have the chat option open, and we are encouraging you to ask questions through that option. We'll be monitoring that. The other thing is, and I have looked through our speaker's slide set, and she's got a lot of information, but it comes very quickly. This will be recorded and will be on the website at the Cancer Survivors Park, which is cancersurvivorspark.org, as well as the Center for Integrative Oncology and Survivorship site at Prisma. So it is the Cancer Survivors Park Alliance that sponsors this in conjunction this month with the Center for Integrative Oncology and Survivorship at Prisma Health. So I'd like to introduce you to Leigh Leibel. Leigh is a clinician in integrative health at Columbia University in New York City. And she's going to be talking to us about the necessity of integrative health. Integrative health combines mainstream medicine with complementary techniques, emphasizing physical, mental, and social well-being. She was scheduled to speak with us in July, but developed COVID and has been on medical leave. And she is actually still on medical leave, but agreed to proceed with her talk and put all together all the slides and whatnot. So I quote, she's 1,000% better, but she still has trouble with some word retrieval. So I just wanted to let everybody know. She's got a lot of degrees and she's working on her PhD. And so the next time we talk to her, we're going to call her doctor. Leigh, thanks so much for being here and playing hurt. And we are looking forward to your comments.
Thank you so much, Dr. Jaguar. I appreciate the kind invitation to speak, and I welcome all of you, and thank you for joining tonight. Let me share my screen. Just bear with me. This is always.
Let me give a shout out to Leanne Perkins, who met Leigh at it was a 2-month retreat that you guys were at 3 or 4 years ago. And so they became friends, and she introduced us to Leigh as a person that would be able to impart a lot of knowledge. So thank you.
That's great. Yeah, Leanne and I were in a fellowship at the National Cancer Institute in Bethesda, 2018. So anyway, I have a lot to unpack tonight. And my topic, which I'm so passionate about, is called the necessity of integrative health. And I'm going to be talking about 6 pillars or 6 different domains that involve an evidence-based approach to whole person wellness. And I have nothing to disclose. So what are we going to talk about today? So a quick outline. I'm going to start out and give a definition of integrative health, just so we are all on the same page and we understand what integrative health is and what it is not. And then I'm going to jump right into the meat of the presentation, which is the 6 pillars of integrative health and wellness. And that is exercise, nutrition and diet, improving sleep, building social support, managing stress, and minimizing our exposure to environmental toxins. And I want to say right up front that I want to acknowledge that social determinants of health are drivers of health disparity and disease, and especially in cancer care. So what is integrative health? Well, it's got several names. It's also called integrative or complementary medicine. And it is a comprehensive, holistic approach to healthcare and well-being that is based on science. Integrative health brings conventional and complementary approaches together in a coordinated way, and it emphasizes multimodal interventions. And that just means that two or more interventions are used at the same time, like conventional health care, maybe physical rehabilitation or psychotherapy, or even medication, combined with complementary approach, such as acupuncture, yoga, or even probiotics. And it's in various combinations of these two. And there's an emphasis, and this is important, an emphasis on treating the whole person rather than, for example, the disease or just one organ system. And integrative health aims for well-coordinated care among different providers and institutions, bringing conventional and complementary approaches together to care for the whole person. And what integrative healthcare is not is alternative medicine. That's something completely different. Alternative medicine is where there are non-mainstream health practices used in place of conventional healthcare. That is not what this is. This is science-based, complementary, or integrative care that you would incorporate into your health and wellness. The National Institutes of Health even created their own division called the National Center for Complementary and Integrative Health. So you can see how mainstream integrative health is becoming. And their mission is to define through rigorous scientific investigation the usefulness and safety of complementary and integrative health interventions and their roles in improving health and health care. So this next slide, there are so many different integrative health approaches or different therapies that we consider as part of integrative health. And I've listed a few in alphabetical order. This is not a comprehensive list. And from medical center to medical center or hospital to hospital, you might have a few of these, you might have all of them. But things like acupuncture, art therapy, cognitive behavior therapy, exercise, journaling, massage therapy, meditation and mindfulness, music therapy, being outside in nature is actually a big one. Nutritional counseling, that would be food as well as your supplements, your vitamins, and maybe herbs. Pastoral care, Qigong and Tai Chi, which are the Chinese mind-body practices. Reiki, which comes from Japan, that is healing touch. Yoga, which comes from India, and so much more. This is just, we're not going to spend any time on this other than just give you a visual of the breadth of integrative health and how it's all interconnected: nutrition, psychological, and physical. Now, who actually uses complementary or integrative health? This was a survey that was done in 2012. It's called the National Health Interview Survey. And it found that about 30% of Americans do use complementary and integrative health. And this tells you what the top 10 most common therapies are that people are using. Natural products would be your vitamins, your minerals, followed by deep breathing, yoga, Tai Chi and Qigong, which are the movement practices. On down, there's massage and meditation.
Leigh, that is a 2012 study. Do you get a sense in the last 10 years if there's been more uptake, or do you have any data to?
That's an excellent question. And actually last night I went through and did a search to see if there was a more recent study coming out. And that was the most recent that I could find. But I, just from my personal experience, I believe that number now would be much higher.
That it's much more accepted.
Yes, absolutely. Great question. Thank you. You know, it's really important to be an informed consumer when you're talking about integrative health and integrative therapies. So you always want to make sure that there are scientific studies that have been done on the safety and effectiveness of any approach that you're interested in. Always talk to your healthcare provider, your nurse, your doctor, and tell them what you're interested in before you start doing it. And choose your integrative health practitioner or your complementary health practitioner carefully, just as carefully as you would choose your conventional practitioner. And before you take any dietary supplement or herbal product, make sure you understand if there are any side effects or interactions with medications that you may be taking. This is especially important for people with a cancer diagnosis who are undergoing treatment. Always make sure you're only using treatments for your conditions that are proven to be safe. And again, I'm going to emphasize, tell your healthcare providers, your nurses, your doctors, as well as your complementary or integrative practitioners, what you're doing. This will ensure coordinated and safe care. Now, there are good websites and there are bad websites that have accurate or maybe not as accurate information. When I put this presentation together, these are the very, very respected websites and organizations that I turn to for information. So you can take a screenshot of this with your camera, come back for the recording, and know that any of these you can go to get really solid science-based information. But
And
if
you know Lorenzo Cohen.
Yes,
Okay,
I do.
so that anti-cancer living is really is kind of must reading. It's written with his wife, who's a nutritionist, and it covers a lot of what we're talking about. But that's an excellent resource.
Thank you so much for saying that. Dr. Cohen is my mentor, actually.
I saw that he wrote for you, right?
Right. I have just written a book and he wrote the foreword. So I actually recommend his book, Anti-Cancer Living, to all the people I work with at the medical center. So if you are going on the internet and you're looking on your own at websites, you need to think about, are they trustworthy? And I'm just quickly going to share with you who runs the website and can you trust them? What does the site say? And do the claims maybe seem too good to be true? When was the information posted? Is it up to date or is it old information? And where is the information coming from? Is it based on scientific research? And why does the site exist? And if you have questions about how to evaluate online resources, you can go to the NIH, the National Institutes of Health, the NCCIH, at this website, Earl, and they have resources to help you evaluate the online websites that you're looking at. So you can make an educated decision based on the evidence. Okay, now we're going to move into the meat of the presentation. I'm calling it 6 pillars or domains for prevention and wellness. Why 6? Well, it could have been 5, it could have been 7. I just selected 6 because that's in my clinical practice. I always point out these 6 really important for people for prevention and good health. And so these pillars are evidence-based and they work together synergistically to provide optimal environment for well-being and health. And each of these plays an independent role. So exercise, nutrition, sleep, stress reduction, social support, which is also love and community, and avoiding toxins in the environment. But the magic, the synergy is created when all 6 of these come together and they can radically transform your health. They can delay or prevent many cancers, as we will see in the presentation. They support conventional treatments, and they can significantly improve quality of life. So the American Institute of Cancer Research has identified preventable causes of cancer, and they have identified through extensive research 12 different areas. And I am just going to read them to you. So tobacco use, and these are preventable causes of cancer. So tobacco use, obesity, overweight, pathogens, unknown, which is just a random misadventure of your DNA, physical inactivity, so lack of exercise, diet, occupational exposures to carcinogenic or cancer-causing agents, alcohol, and that includes wine and beer, reproductive factors, ultraviolet light, so sunshine or radiation exposure, environmental pollutants, and some prescription medications. So based upon their research, they found there were 12 preventable kinds or 12 ways to prevent cancer. They have issued a cancer prevention recommendation. And again, this is the American Institute for Cancer Research. And so they say, be a healthy weight, be physically active, eat a diet rich in whole grains, vegetables, fruits, and beans, limit consumption of fast foods and other processed foods high in fat and starch and sugar, limit consumption of red and processed meat, limit consumption of sugar and sweetened drinks, limit alcohol consumption, do not use supplements for cancer prevention, and for mothers, breastfeed your baby if you are able to, and after a cancer diagnosis, follow these recommendations if you can. Now, as I said, integrative therapies really have gone mainstream. And this is evidenced by this slide that says the American Society for Clinical Oncology, ASCO, has endorsed integrative therapies during and after breast cancer treatment. And you can Google this and look at the whole paper online, and it tells you that such things as yoga, meditation, and mindfulness, music therapy, massage, acupuncture are all recommendations to help with your side effects during breast cancer treatment and after for lingering or late side effects of chemotherapy and other treatments. Now, I'm not going to spend any time on the next 3 slides other than I wanted you to have access to them and know about them. So the National Comprehensive Cancer Network issues guidelines on, they issue guidelines on what kind of chemotherapies, what kind of immunotherapies are protocols for cancer treatment. But they've also issued recommendations for integrative therapies, certain integrative therapies for certain specific things. This one is cancer-related fatigue. This one is for distress management, which would be anxiety and anger and things like that. And this one is for nausea and vomiting, which is so common during chemotherapy. So just, you can take screenshots of this later on the recording, and it's just really good information to know. And this supports the notion that integrative health is mainstream. Now, pillar 1 is exercise. Exercise is medicine, so moving for wellness. This is going to be my longest module because exercise is so incredibly important for our good health. So I'm starting off with a research study, and it says it's called The Effect of Physical Inactivity on Major Non-Communicable Diseases Worldwide, an analysis of burden of disease and life expectancy. So they're talking about the effect of physical inactivity on cancer, diabetes, type 2 diabetes, and coronary heart disease. And the takeaway here is the investigators say, physical inactivity seems to have an effect similar to that of smoking or obesity. And we know that smoking is carcinogenic. It does cause cancer. So this is a really important study, which then leads to this slide. So if I can read this, this is the American College of Sports Medicine in conjunction with the American Cancer Society. They say that exercise can prevent and reduce the risk of cancer and these other so-called lifestyle diseases. And they go on to say that key points for all adults, exercise is important for cancer prevention, and it specifically lowers the risk of 7 common types of cancer. They are colon, breast, and this is postmenopausal breast, endometrial, kidney, bladder, esophagus, and stomach. They go on to say for cancer survivors, incorporating exercise to help improve survival after a diagnosis of breast, colon, and prostate cancer. And that is all heavily researched. And then the third point would be exercising during and after cancer treatment improves fatigue, anxiety, depression, physical function, quality of life, and it does not exacerbate lymphedema, which is important for people who have had their lymph nodes radiated or had surgery. So exercise is so important for us that the U.S. Department of Health and Human Services has issued physical activity guidelines for Americans. And they say to attain the benefits from physical activity, we need at least 150 to 300 minutes of moderate intensity aerobic activity. That could be a brisk walk or fast dancing in the living room to some music, and that should be done every week. They also call for muscle strengthening activity, and that could be lifting weights, or it could be doing something like push-ups, and that should be done 2 days a week. So the takeaway from this is move more and sit less. They say any amount of physical activity does have some health benefits, and you can experience immediate health benefits from exercise, reducing anxiety, reducing blood pressure, improving quality of sleep, and insulin sensitivity. So benefits of exercise for young people: physical activity can improve cognition, bone health, fitness, heart health, and reduce the risk of depression. For adults, as we said, physical activity can help prevent 8 different kinds of cancer: bladder, breast, colon, endometrium, esophagus, kidney, stomach, and lung. Exercise can reduce the risk of dementia, including Alzheimer's disease, heart disease, stroke, high blood pressure, type 2 diabetes, and depression, and it can improve bone health, physical function, and quality of life. For older adults, exercise can lower the risk of falls and, importantly, injuries from falling. For pregnant women, it reduces the risk of postpartum depression. And for everybody, it reduces the risk of excessive weight gain and helps people maintain a healthy weight. And then there's also new evidence that says that exercise, physical activity, can help manage existing health conditions. So it's not only preventing them, but if you already have a condition, exercise can help to either stabilize it or reverse it. So this would be helping with osteoarthritis pain, hypertension, type 2 diabetes, reduce symptoms of anxiety, depression, and it improves cognition for people with dementia, multiple sclerosis, ADHD, attention deficit disorder, and Parkinson's disease. If you do have a cancer diagnosis, the evidence is so strong that the American Cancer Society has issued specific guidelines for cancer survivors. And I've listed the details here. It's basically avoid inactivity, return, and this is whether you're in treatment or you've finished your treatment, return to your normal daily activities as soon as possible, take part in regular physical activity, start slowly, build up. And again, we have this dosage, this prescription of 150 to 300 minutes of moderate exercise a week. And that also could be 75 to 150 minutes of vigorous intensity activities a week. So you can either do the shorter amount of vigorous activity or more minutes of the moderate activity. And moderate is taking a walk. They suggest you exercise 10 minutes at a time. You can break it up during the day. You don't have to do it all at one time. You could do 2 minutes here, 2 minutes there throughout the day. It's cumulative, the effects. And then resistance training exercise for your bones 2 days a week, and stretching 2 days a week.
And I think it's become also the case that we encourage this kind of activity, not every day, but even when people are going through the therapy, to not lose that muscle mass, not lose their cardiovascular capabilities while they're going through therapy. They may not be able to do it as well, but just try to be up more and sit less.
That's so important. And, always check with your healthcare team, your doctor and your nurse, before starting any exercise program. Exercise is for everyone. Now, I'm not going to read this. I just put in, there are many different ways to be physically active. You can garden, you can vacuum, you can scrub the bathroom, you can take a walk, use the stairs instead of the escalator. So these are just, you can go back, and they're just sort of fun ways to incorporate activity into the day. And again, I just want to talk about disparity in healthcare. And there are social, economic, and cultural factors that really influence a person's ability to make lifestyle changes. They can influence a person's body weight, their ability to get physical activity, their dietary patterns, alcohol intake. So we really need to do a better job as a society to increase access to affordable nutritional foods for everyone, and to provide safe, enjoyable, and accessible opportunities for physical activity for everyone. Nutrition, food is medicine. We are what we eat. Here's the plate that you always see. It's the round dinner plate, and it shows us clearly what portion of the plate should be filled with each of the different kinds of food. And you can see that half of your plate should be vegetables. You should have fruit, grains, beans and legumes, a little bit of nuts and seeds, and then your lean, clean animal protein. It's hard to figure out what to eat. So I put together a resource guide for you. I'm not going to read it. This is for your information. You can go to each of these websites and explore. I want to bring your attention to one, which I think is so cool. Memorial Sloan Kettering Cancer Center in New York has a database on herbs and supplements, and it's free. It's for the general public, and this is the URL, the website for it. But if you are curious about any vitamins or anything that you're taking and how it might react with other things, this is the trustworthy resource to go to. And I also want to bring your attention to this last bullet. If you can't afford enough healthy food, you can check out some programs that can help you. And if you go to this usa.gov/food-help, you'll find lots of programs to help you with getting access to healthy and nutritional foods for you and your family. This is really interesting. So being at a healthy weight is the most important thing you can do to prevent cancer, besides not smoking. And only half of Americans are aware of this, that there is a link, a very strong link between obesity and cancer. And this is from the American, gosh, I can't read it. I think it's the American Association of Cancer Research. It is hard to lose weight, and it is hard to eat right. So here's a resource for you. The American Institute of Cancer Research has a free Healthy 10 challenge. So there is a 10-week interactive program that you can join, just putting in your email, and they will tell you about building healthy habits to eat smarter and to move more. And you just go on the web. This is the URL for the website. You just look for this on the homepage, accept the challenge, give them your email, and it's I've done it myself. It was really a fun and important 10 weeks that I took the time for myself. Okay, lots of us have farmers markets in our neighborhoods, and this is a seasonal list of nutritious foods that you can buy at your farmer's market, summer, fall, winter, spring. And so this is a resource for you. You can go back and take a screenshot of it and put it in your shopping list. You know, I have so many people that ask me about vegetarian diets. Well, here's a study, and I'm a meat eater. So this is a study that says vegetarian diets and the incidence of cancer. Let me just read exactly what it says. I'm sorry. This was a study conducted in, I think it was in 2013, and it was a retrospective looking at 69,000 participants in a study. And they looked at their diets and whether or not they were diagnosed with cancer down the line. And it said that those who ate a vegetarian diet, it seemed to confer protection against cancer. And then this is just a visual that sort of shows you what the data was. So if you look here, a non-vegetarian diet versus a vegetarian versus vegan, you can see that, you know, the risk of developing cancer is higher with non-veg versus veg versus vegan. And this study was in the American Association of Cancer Research, Journal of Cancer Epidemiology, Biomarkers and Prevention. So a really important journal. And I found this, I just had to include it when I was putting my slides together. For anybody that's interested in the carbon footprint of their food and greenhouse gas emissions, and honestly, I really didn't know much about this, but this shows you that different kinds of proteins put out different greenhouse gas emissions, and beef is, you know, by far the, you know, in the lead. I just thought this was really, really interesting, and I wanted to share it. Now we move into sleep. And it's important to say, well, how much sleep should we be having? So one of your trusted resources is the National Sleep Foundation, and they give recommendations for sleep duration. So how old you are, and then the recommended amount of sleep. And so for adults 26 to 64, 7 to 9 hours are recommended. And for adults over 65, 7 to 8 hours are recommended. So it's good just to know what's the baseline, like how much sleep should I be getting? And then
Your teenagers aren't just lazy, they need more sleep.
they do. And even the younger ones, of course, even more, the toddlers, the elementary school and the newborns. Yeah, it was really interesting to look at. And sleep disturbances fall into 6 main categories. So you may say, oh, I have trouble sleeping, but in order to solve the problem, you need to identify like where the problem is. So you might have trouble falling asleep. You might have trouble staying asleep. So maybe you're waking up during the night. You may wake up too early. You may not sleep long enough. You may have an irregular sleep schedule, or you may just have an overall poor sleep quality. And so the same organization, the National Sleep Foundation, has put together tips for all of us to get a better night's sleep. And they've divided into daytime tips and evening tips. So a lot of it's common sense. Daytime tips would be get some sun exposure, go out and be in the sunshine, get your exercise every day, And for sleep, they say aim for 30 minutes a day, 5 days a week. And then they say keep a regular meal time. So eat at regular times every day. Then we move into evening tips, and they tell you to avoid a heavy meal. And that would also be, spicy foods. Avoid nicotine, caffeine, and alcohol before bed. And this would be, I would say, start in the late afternoon or the mid afternoon on these. Then we need to have a wind down. So use a consistent routine with a relaxing wind down to help you get the rest you need. And it's important to consider your environment. Your room should be cool, on the cooler side. It should be dark. It should be quiet. And put your devices away. TV, an hour before bed, turn the TV off. Don't get on the computer or the iPad or the phone. That will disrupt your sleep. And why is it important to get a good night's sleep? I know we just, you'll feel bad the next day, but for our health, it's important to get a good night's sleep. Look at these studies that I found. So poor sleep has been linked to weight gain, diabetes, cardiovascular disease, Alzheimer's disease. And these are the studies, if you want to Google them and look at them. And it also, a lack of sleep increases the cancer risk and increases poorer outcomes for cancer survivors. To that point, these are the two studies that support that statement. There are others, but these are the two that I've selected. So a 212 study at Case Western Reserve University found postmenopausal women who have chronic lack of sleep were more likely to develop more aggressive forms of breast cancer and had increased risk of recurrence. The investigators, many of the same investigators, the year before had done a study on colon cancer and found that people, and this was a study of 1,200 people who reported sleeping less than 6 hours a night, had a 50% greater risk of colorectal adenomas. And this is a precursor to colon cancer, compared with people who said that they had slept an hour more, or at least 7 hours. And so these are the two, you can Google and look at the study yourself. It's really interesting. So moving along, okay. Pillar 4 is love, social support, community. I'm going to share a couple of studies because I think we don't realize the importance of being with other people and how dangerous loneliness can be for our health. And so this first study is it's a study on loneliness for older people who were either living alone or living by themselves. And they wanted to see if the social or emotional loneliness contributed to an earlier death. And they looked at 413 older adults who were part of the Berlin aging study. And the conclusion was that, well, yes, loneliness is associated with increased risk of all-cause mortality in older people who live alone. And one of the things they identified was that the loss of a partner seemed to be really one of the toxic components of loneliness and added to this, this incredible finding. Another study looking at depression as a predictor of disease progression and mortality in cancer patients. And it says that this was a meta-analysis which looked at the extent to which depressive symptoms and depressive disorder predict disease progression and mortality in cancer patients. And they concluded that there is reasonable evidence that depression predicts mortality, but not progression of disease in people with cancer. Two more, I'm not going to go into them other than just to say both studies on depression and depressive symptoms and the prediction of survival with renal cell carcinoma and with bladder cancer. And so the take home here is really important for us to stay connected. There's a healing power in groups, whether that's family, community, neighbors. Online support now with COVID, we all know about connecting online via the Zoom room. Importantly, leading a purposeful life or a meaning-filled life. Helping others is a huge one. There were so many studies I wish I had time to talk about, but volunteering and doing things for other people. And if you are interested in volunteering from your home online, the United Nations has a site called UN Volunteers, and this is the link, and you can go in and sign up to be a volunteer to work with people all over the world, which I think is just so much fun. Pets are important. Playing with your pet, cuddling your pet, faith communities. And just to sum it up, as we saw in those studies, loneliness can be lethal, and strong support systems can slow cancer progression. So that's great reasons to reach out and touch someone. Now we come to the fifth pillar. We're almost at the end of the talk. This is on stress and resilience. And of course, that's managing stress. And for anybody who likes the science, I put this picture up here. I'm not going to go into it other than just to say acute stress is normal. It's the chronic stress that's dangerous. So when we have chronic stress, and it can come from, chronic stress can come from physical, emotional, mental, it comes from all different directions. But you create or produce stress hormones, cortisol, epinephrine, norepinephrine, and these are running through your veins. These hormones are going through your veins, your digestive, immune, and other regulatory systems. And they either will sort of stop you in your track, or your systems will start to falter due to the chronic stress. The chronic stress causes inflammation, and that's really what is implicated in one of the things in stress. And why do we care if we're stressed out? Well, here's a study that came out in 2020 from Roswell Park Comprehensive Cancer Center, and they found, their Department of Radiology and Immunology found that chronic stress can minimize the therapeutic response to radiation. So for people who are undergoing radiation as part of their cancer treatment, this is huge news. This is a reason to start meditating and doing some relaxing diaphragmatic deep breathing practices. I'm not going to go through, well, let me see, do I want to go through this or not? And again, this is all available for you to go back at your leisure and look at. I know I packed so much into this. It's good stuff. I wanted to share it all with you. Let me just check. Yeah, I'm gonna skip this. Other than just to say that there are stress causes changes in our immune system. And that's what the other slide was. And these next two slides are really showing you that mind-body practices can be an antidote to stress, like it reverses it. So yoga reduces inflammatory signaling in fatigued breast cancer survivors. This was a big randomized controlled trial and done at UCLA. And here's a second one on Tai Chi and how that mind-body meditative movement practice can really change our gene expression and change our inflammatory pathways. This was also at UCLA. This is my area of interest, is yoga. Yoga has a role across the cancer care continuum, from diagnosis through survivorship And again, it does change biomarkers and pro-inflammatory cytokines. And, feel free to go back and take a look at this. And as I said, mind-body therapies are an antidote to stress. And the goals of a mind-body practice are to help you feel more in control, less bothered by little things, and better able to handle the bigger stuff. They can help you move away from that feeling of constantly being overwhelmed with the stressors of your day. It can give you a few moments of peace. You might feel unencumbered, free, or even light for a few minutes every day. And it can help you start living a more active, less reactive life so that you respond rather than react. You take a minute to pause before you respond to something. And again, mind-body therapies would be something like yoga, meditation, mindfulness, Tai Chi, Qigong, imagery, loving kindness meditations, the deep belly breathing. I think everybody knows about that. Being in nature, especially walking barefoot on the sand on the beach or in the grass in your yard, doing journaling. And our last pillar, number 6, is environmental toxins. And I'm only going to share one slide. So consider how environmental toxins affect our bodies and our ability to stave off disease. So I just want to read you these statistics. Since the 1970s, more than 87,000 chemicals have been approved for commercial use. Yet over those thousands and thousands of chemicals we've developed, only 1,000 have been formally examined, and they've been graded for their carcinogenic or cancer-causing potential. Of that 1,000, half of them, 500, have been found worthy of being graded on what they're calling a cautiously worded scale. 120 chemicals have been identified as known carcinogens. 81 have been identified as probable carcinogens, and 299 chemicals are classified as possibly carcinogenic. And this is according to analysis published by the World Health Organization, WHO. So know your environment and know your health. Take a look at, well, I'm so excited to share resources, but this one right here, the Environmental Working Group at this website, they offer incredible resources on what is in your household cleaners, what is in your cosmetics, and what is in your body care products, what's in your suntan lotion, what are you putting on your children's skin, and they rate them and say safe or not safe. So I would, if you're interested in this, take a look at their website. And this book, I love this book. It's called Living with a Green Heart. And it's how to, just everything in our environments, in our homes, in our lives, how to avoid toxins. And here's one thing, cash register receipts. Some cash register receipts have a chemical on it that is a hormone disrupting compound. I mean, who knew? So, yeah, go to this website. So you know how we take, do you want your receipt? You take the receipt, you get it on your hands, right? Then you rub your face. Yeah. So there we go. In conclusion, integrative health aims to treat the whole person, mind, body, spirit, not just the disease. And the 6 pillars of wellness are science-based. They work synergistically, and each plays an independent role, but the magic is the synergy that's created by utilizing all 6, and that can radically improve your health. So thank you so much. And I love this reminder, walk more, sit less. They say that sitting is the new smoking. So get up and go for a walk. And please feel free, this is my email, feel free to send me an email later if you have any questions or you want copies of the studies, and we're going to open it for a couple of questions.
Yeah, Leigh, that was great, and there's a lot to digest there. I think we have a pretty shy audience. We have not seen anything in the chat box. But, one of the things that I think we need to emphasize is the fact that, while this has become mainstream medicine, integrative medicine, complementary medicine, we have to be somewhat good about researching the reputable stuff, the reputable practitioners. While this exists around the country, sometimes it doesn't necessarily exist in your area. One of the topics you talked about from the standpoint of sleep disorders, and we see a lot of this in patients before they develop a cancer diagnosis, but certainly after they have been through therapy and whatnot, and the stress and that sort of thing. You mentioned in your alphabetical list of all the integrative health options, cognitive behavioral therapy. And I would mention there is a sub variety of cognitive behavioral therapy -I, which deals with insomnia. So it is a situation where these don't exist in every city. I don't think that I found one in our area, but these are CPTI practitioners, and they sometimes can help. Most people are looking for non-medicinal ways of gaining back sleep capabilities, and so these can be helpful. We do have a question in the chat. Let's see what that shows here. Elsie, can you read that? So there is, so Leanne, your friend, great information, Leigh. You covered this so well and offered great resources for viewers to look up later. So I think that's a good reminder. I encourage everybody to go to the website. Again, that's cancersurvivorspark.org. Leanne, if you have, if it's going to be on the CIOS website, if you could just put that site up there too, that would be great. But I think it's one of those things that there are so many references there. My wife looked at these slides with me before we met, and she loved the farmer's market slide for the various seasons. Our farmer's market is kind of spring to early fall, but there are some farmer's markets that are all year round. So a lot of things from that standpoint. When you go to Leigh's website, you know, she is a global innovator along with everything else. So she's been spending some time in Africa and has done some studies in Nigeria and has worked with 11 other countries. And I asked her if that, from the standpoint of not having a lot of traditional / conventional care options in a third world setting, has that kind of made her more in tune with some of these complementary therapies? And I'll let you speak to that.
I know I've been thinking about that. You asked me that when we were, you know, in the pre-run.
Right.
You know, what I want to say about that is working internationally has really opened my eyes to all of the indigenous systems of health that, being an American, I didn't know about.
Right.
And I think that's really one of the most beautiful things about working internationally. It's sort of it's sharing. Certainly I can share the practices that I know about, but here's the irony. So the meditation and the yoga and the Tai Chi and the Qigong are all from the East. So, right. You know, I'm taking it back over to them. But it's really wonderful to be able to share what we know is evidence-based to help with survivorship and prevention, but at the same time to learn and really respect and honor the traditions from different cultures and different countries.
Yeah, very, very well said. And an hour lecture, maybe a little less. It's logarithmic, the amount of time you put into this. So I can't thank you enough. I hear that you've written a book. This is the point where you can do a shameless plug for anything you'd like anybody to read or
Well,
emphasize.
thank you. Well, I want to plug Dr. Lorenzo Cohen's book, the one that's on the resource list, the Anti-Cancer Living. He is head of integrative medicine at MD Anderson Comprehensive Cancer Center in the University of Texas in Houston. It's a marvelous book. I mean, I have 3 copies in my home, and I make sure to recommend it to all of my patients that I see at Columbia. Right. But yeah, let me plug my book. So I have written a book, which is supposed to be published on the 18th of September. It's called Yoga Therapy Across the Cancer Care Continuum. And it looks at the science and the clinical application of the tools of yoga, from diagnosis through treatment, survivorship, whether that's no evidence of disease and cure, or whether it's living with chronic cancer and managing it, all the way to end of life and hospice care. So yeah,
it'll be on Amazon.
It'll be on Amazon, and I get, I think, 50 cents for every book that is sold. So yeah,
that'll help with your healing. Okay, well, we will plug that on all our websites, and certainly from the standpoint of all the resources that you provided, we just need to get that out to the community, because we really are interested in preventing disease rather than reacting to disease. That ought to be our goal and our mantra.
Right. Thank you so much for this wonderful opportunity to share with all of your friends down in Greenville.
And when you come this way, we'll show you the park, and you get a first hands-on look at that. Let me also, speaking of plugs, next month we have on September 8th, it's titled Welcome to Your Brilliant Body. And this will be Ann Lowell and Maria Kugler, who are 2 certified health and wellness coaches. And we always end with a quote. And this is apropos to what Leigh said about social connections and volunteering and that sort of thing. It's been attributed to Pope Francis, but it's really comes from a Sanskrit quotation. So let me just read this before we leave. And again, thank you very much, Leigh, for helping us out tonight. Rivers don't drink their own water. Trees don't eat their own fruit. The sun does not shine for itself, and flowers do not spread their fragrance for themselves. Living for others is a rule of nature. Life is good when you're happy, but it is much better when others are happy because of you. So you all have a good evening. And again, Leigh's presentation will be on our website, and please refer to it often. Thank you.